cryptosporidiosis vaccination. Today we're going to be exploring the practical realities of vaccinating against crypto. We know some clients and even vets can be hesitant about vaccination. So over the next hour, we're going to be addressing the most common concerns, including extended colostrum feeding, use of bovilis cryptium in Johne's positive herds, and the growing challenge of antibiotic resistance in scour prevention and treatment. We've got a really great lineup of speakers. We've got Dr. Kat Baxter-Smith from MSD Animal Health. She's their veterinary advisor, who's going to discuss the real cost of cryptosporidiosis. Unfortunately, Professor Dirk Whirling from the RVC can't be with us, but has pre-recorded his presentation. So we'll be giving that. And that's going to be discussing antimicrobial resistance in calf health. We've also got Dr. Katie Denholm from the University of Glasgow, who's going to cover calf immunity and extended colostrum feeding strategies. And Peter Orpin, chair of the Action Group on Johne's Technical Group, who will talk about navigating Johne's and vaccination. So each of our speakers are going to share their insights, and then after all the speakers have presented, we'll open up to a dedicated Q&A session. If you have got a question, then please drop that into the chat function at the bottom of the screen, and then we'll come to them at the end after all the presentations have been given. So without further ado, we'll crack on with Dr. Kat Baxter-Smith.
Thanks, Sarah. Hopefully you can hear me okay. I'll just move the slides along. So I'm doing a short introduction on the cost of cryptosporidiosis. Hopefully a lot of you are very much aware of this disease. And the idea of this webinar really is to provide a bit of a higher level insight into the disease and vaccination and maybe some of the barriers, as it is a new vaccine that we have now, and quite a few farms are now using it. So if we've got some very technical questions, we'll be happy to try and answer them for you. So I'm sure plenty of you might have seen a slide like this before, but as we know, the impact of cryptosporidiosis is pretty high. This photo on the right shows the villi of a normal calf. So you can see here under the microscope these finger-like projections, which really increase the surface area of the calf's intestines, allow it to absorb the water and nutrients that it needs to live and grow. And with crypto in particular, it really causes severe stunting of those villi. So the villi are probably less than a quarter of the size that they should be, and this really massively limits the calf's ability to absorb the nutrients that it needs. And really what we do see with crypto is an impact on growth rates. And I've got a couple of studies to demonstrate that for you. But that does seem to be the big issue that we see. So this study was done by Hannah Shaw at the Moordun, and they looked at the impact of crypto in beef cattle up in Scotland. And they had 3 groups of calves. They had severe disease, mid-range disease, and low clinical disease. And they looked at crypto sort of from birth up until about 6 months by measuring weight gain. And what they found was the severe disease calves weighed on average 34 kilos less than low disease calves, which equated to around 160 pounds less in sale price. So they didn't actually catch up. That was the interesting part, because farmers often do think, oh, okay, they have crypto in pre-weaning phase, but they'll catch it up later. But actually this study found that they didn't. And it's quite hard to see from the graph, but the blue and the orange lines represent severe and mid-range disease. So the blue line is kind of under the orange line, but they are very similar. So actually mid-range disease is not much different to severe disease in terms of the weight reduction in weight gain. Then we have here a PhD, which was done by Berger in the Netherlands, looking at very extensively the cost of crypto, and they calculated it was 141 euros more expensive to rear a dairy heifer if they had cryptosporidiosis on the farm. And per affected animal, this came to around 195 euros. So there's per animal on the farm and then per affected animal on the farm. So even if the animal isn't actually clinically affected, it still is increasing the cost to rear that animal. Also, what we've found, because we've done quite a lot of survey work, as MSD, and asking the farmers about how they feel about crypto. And I know farmers don't necessarily like to talk about their feelings, but this is something that came across quite strongly. It's harder work to look after the calves, so they're spending more time in the calf pens, dripping calves, treating them. It's really hard to get rid of. Once it's there, it's very persistent. They see dead calves, they see sick calves. One farmer said, I dread calving time, which I think is sad to see. So this really came across strongly. It's something that is important to us, I think. And as there's more going on about the farmer's mental health. It isn't nice to be treating these sick animals. So we've got the vaccine. This has been out now for 6 months or so, maybe longer actually. It was certainly before the back end of 2024, I think we first got it, Bacillus cryptium. I'm sure plenty of you have heard about it. We've been out and about talking about it quite a lot, and it's really great to see people engaging with it. There's been a really encouraging uptake from farmers. Farmers are very interested and keen in this vaccine, and this is the reason why we've been running these webinars, is to try and get the answers to questions that we get commonly. So this is really your opportunity to ask those questions. This is a kind of sciencey bit. This vaccine actually took about 20 years to create because it was very, very difficult to actually make. So they first tried making a vaccine which just had whole cryptosporidium parvum oocysts to see if that would cause an immune response in the animal. And unfortunately, it did not. So you can't vaccinate a cow with whole cryptoosis essentially and expect a decent enough immune response. So then they had to then sort of analyze the actual surface protein antigens on the sporozoite and individually test each one to see which would produce a decent enough immune response in the animal to produce antibodies, which then go into the colostrum and protect the calf. So this took quite some time, but the vaccine candidate GP40 was found to be the best at this. So GP40 is a really key surface protein. It mediates the infectivity and pathogenicity of the crypto. So it basically enables the attachment to the gut lining cells. So this was the key protein, and I think the breakthrough in the creation of this vaccine. And this is what the vaccine stimulates an immune response to. So it's given to the dam. She produces antibodies to that surface protein. Those will pass into her colostrum as long as the vaccine is given at the right time. And then the colostrum is full of antibodies, which will line the gut of the calf and prevent that crypto from attaching to the gut cells. So as long as the calf gets the colostrum, it will help to protect it. And the antibodies attached to 4 different life stages of the C. parvum. So sporozoites, trophozoites, meronts, and merozoites. Right. That's the sciencey bit done. So that's what it's licensed. That's the license claim. So you give it to the pregnant animals, cows or heifers, to raise GP40, and calves need to be fed colostrum to get the benefit. Can be used at the same time as rotavirus corona as well. If you like things visually, this is sort of how it works in terms of when it is given. So in the first pregnancy, we do need 2 doses. So that's unlike rotavirus corona, and I would strongly recommend that is done. We have had a few farmers that think they can just do 1 dose. The efficacy of the vaccine is not good enough if they're just going to do that. So they should be giving 2 doses in the first pregnancy, 4 to 5 weeks apart. Either dose can be given with rotavirus corona and leaving ideally 3 weeks prior to calving. Then in subsequent pregnancies, they just need 1 booster dose, which can be given at the same time as rotavirus corona. So I think this vaccine schedule is important to adhere to. In terms of feeding calves, so the difference with this vaccine really is that we are encouraging what we're calling extended colostrum feeding. So this can mean 2 things. It can either mean that you harvest the first milking colostrum and potentially the second milking colostrum from the cow when she first gives birth, and then add it to the milk replacer of the calf, or you feed the calf entirely from colostrum and transition milk from the dam. So this will depend partly on your farm, the farm that you want to implement this on, their disease status. That we have Pete here who's going to talk a bit more about Yonis and consideration around that. But so there's two ways of doing it, and Katie's going to go into more detail of how this can be done. And we have farms doing both. So either feeding colostrum or transition milk from the dam for the first 5 days, or supplementing with the following amounts of colostrum and or transition milk. Ideally, if you're going to do the second choice, you really want to be using your day one colostrum, because that's got the highest level of antibodies in it. As you go down and start using transition milk, there's obviously a lower concentration of antibodies in it, so you have to use a higher volume to get the same effect. So if you can harvest the colostrum from the first day, that will really give you that high level of antibodies that you need to protect the calf. So day one, at least 3 litres of colostrum. Day 2, at least 1 litre, and then days 3 to 5, at least half a litre can be added to the transition milk. So that is what we highly recommend. Again, we've had farmers who want or are trying to give less than this, and it really does depend on how good their hygiene is, I suppose. So we've had farms that are doing less than 5 days and have had okay results, but we've had best results with farms that are giving it for at least 5 days. So I think I would really encourage your farmers to do it for 5 days. This is what we're seeing the best results of this vaccine, and when people are doing this properly. We also have that we produced to help with this vaccine. So what we would recommend before you start this vaccine on farm is actually go onto the farm and run through our cryptosporidiosis control planner. We produce this in conjunction with the Mordun, and it runs through the 5 steps that you need to do on farm to help you control crypto. So, I think this isn't really a vaccine you can just kind of bang in and hope for the best. It isn't. It's a vaccine that you want to use properly. So you need to diagnose, make sure you've actually got crypto on the farm for a start, and check there's nothing else going on. Do your colostrum properly, that's key. Environment and management. Again, if the environment is filthy, the vaccine won't have much of a chance to work. Your vaccination protocols, are you using a rotacorona vaccine as well? We would recommend you do. And then are calves being sort of treated quickly enough if there is a problem? So this can be got from your MSD account manager. Great, that was my quick whiz through. So I think what we're going to try and do now, if you have questions, please put them in the chat for me or any of the other speakers, and we will come to them at the end. So what we're going to try and do now is to share the video from Dirk. And
now, my name is Dirk Welling. I work at the Royal Veterinary College, and what I would like to tell you today is about how antimicrobial resistance and cryptococcus treatment go together. But before that, let's start here. Why is the antimicrobial cycle so detrimental for us? Well, it's not only that whatever we do to calves via meat and other products we get back in humans, but also we are aware that more and more of these antimicrobial residues go via the manure into the environment, or from the humans via the sewage into the environment, and affect the environmental microbiome as well. So this really has massive impacts, and you can see this impact on the microbiome already in vivo. So here are some data on the effect of antimicrobial usage on the microbiome in mice, and please just concentrate on the colors. These are mice, or this is the composition of the microbiome in mice before treatment. This is the microbiome in mice that were only treated with the antibiotic vehicle, and you can see there are already shifts in the microbiome. But here you can see the shift in the microbiome based on the antibiotic treatment. And this goes hand in hand with a shift from the positive microbiome partners, the firmicutes, to the negative microbiome Progitella. And this antibiotic treatment not only affects the microbiome, but it also affects the composition of the short-chain fatty acids produced by this microbiome. And you can see here that specifically butyric acid and butyrate are massively reduced in those animals, in those mice that obtained antibiotic treatment. And this is also the same in calves. We know that there's an effect of early antibiotic treatment in the first week of life, including feeding of antibiotic-containing milk. And this effect persists very long through the epigenetic. This early antibiotic treatment, similarly as seen, reduces not only the diversity of the microbiome, but also parameters of the metabolic turnover, such as lactate and butyrate, and leads to increased protein fermentation. Via the gut-lung axis, the intestinal microbiome also impacts on the lung microbiome. This is primarily via the absorbed short-chain fatty acids. So if we disturb the microbiome in the gut, we also disturb the microbiome in the lung. This early antibiotic treatment also increases the risk of colonization of tonsils with antibiotic-resistant pathogens, such as Salmonella, and increases their distribution. It increases the odds ratio that calves that have early antibiotic treatment has further infections in the lungs later on in life. It also has an impact on the productivity of these animals. So calves that have early antibiotic treatment and grow into heifer have a 2.5 times increased odds ratio to die after the age of 90 days. If they survive, they come later on into first estrus. But that also means that they have the first estrus delayed up to 6 months and have a 2 times increased likelihood to not finish gravity. And obviously that goes hand in hand with milk production. So what is much better to do than treating cryptosporidium infection with antibiotics is actually to vaccinate against this, but we don't really know what cryptosporidium we have. So the cryptosporidium doesn't exist. Crypto is part of the Apicomplexa family or genus that also contains, to which also Eimeria and Plasmodia belong. So far, we have at least 157 recognized species of cryptosporidium. In addition to this, we have about 120 different genotypes, which again could be own species. And the most important one is actually Cryptosporidium parvum, which is a zoonotic pathogen affecting ruminants and humans. Now, important is that the transmission of this Cryptosporidium parvum is always fatal, and less than 20 oocytes are enough to establish an infection. So the oocytes are also very stable in the environment. They can be destroyed by high temperatures and or drying out, but clearly it is better to not have oocytes occurring in the environment rather than having to clean them away. So what has happened? We have Cryptosporidium parvum infection in young animals from birth to 6 weeks with the typical clinical symptoms. Later on in life, it's predominantly Cryptosporidium bovis, Cryptosporidium rhinei, and Andersoni. But we have also Cryptosporidium parvum in these animals. And the problem here is that we have no clinical symptoms at these stages of life. So if we now have the ability that Cryptosporidium, that we only need 20 oocysts of Cryptosporidium to infect other animals, you can imagine what happens if we have asymptomatic spreaders in this area. After the oral uptake, the Cryptosporidium attaches to the cell walls. It penetrates into the host cells. That subsequently leads to massive GI tract damage cells, because when these neurons pop, you can see they're in the intestinal epithelial cells. They then release the merozoites, which then either go into the next replication cycle or go into the thick-walled oocysts. But you can imagine that if you have damage here in the epithelial layer, that opens up the path for infection with other pathogens. What we know since a couple of years from other apicomplexa is that we actually have glycosylated proteins or lipids present on the surface of these. So for example, attachment of Plasmodium to erythrocytes can be significantly reduced using antibodies to these specific glycoproteins. That unfortunately doesn't work in Imeria. We don't understand yet why, but clearly this is a possibility, but doesn't seem to be an easy possibility. And therefore, we also know that if we want to have an intervention via vaccine, it has to come early on in life, and therefore the best way forward is really to vaccinate the mothers. So what MSD has done is a trial and error approach. They identified specific antigens on the sporozoite where they could show that if they inhibit these antigens, then there was no attachment of the sporozoite to the enterocytes. That's why they came up with 4E9, no, not a robot, but an antibody. And the astonishing thing of this antibody is that this antibody neutralizes two different glycoproteins, a GP40 and a GP900 glycoproteins. And the important thing of these two glycoproteins is that they are expressed on more than one developmental stage. Whereas this GP900 seems to have a low immunogenicity, the GP40 has a high immunogenicity. And when they tested this in vivo and looked at the clinical scores of calves coming from vaccinated mothers, what they could see here is that the clinical scores of calves, so the diarrhea score of calves from vaccinated mothers was definitely lower compared to non-treated test animals. And overall, you can really see that there's a significant inhibition of the clinical scores in the treated group compared to the non-treated group. So there's a significant better clinical group, and there's a shorter duration of the disease in the test group. But more importantly, also, it's that the days the calves in the test group had severe diarrhea, and the length of this diarrhea was again massively reduced. So a significantly lower diarrhea score in the test group. And all of that then leads to the summary that, yes, we need to think about what we're doing with antimicrobials and antimicrobial residues in the environment, and also how they impact on the environmental microbiome. Early antimicrobial treatment of neonatal calves has a massive negative impact on their long-term health and their performance later on in life. We are now able to vaccinate against intestinal parasites that we thought was impossible to do some years ago. And new technologies, such as a better understanding of glycobiology, help massively to achieve this, as demonstrated here for cryptosporidium and also recently for Homunculus contortus in sheep. And with that, I thank you for listening and happy to answer any questions.
So now we welcome Dr. Katie Denham, who's going to be talking about calf immunity and extended colostrum feeding strategies. Over to you, Katie.
Okay, thanks. Thanks for having me. I'm not going to spend loads of time today going over failure of passive transfer, because I think you guys are pretty familiar with it. But just in the interest of getting everybody on the same page, this is a calf in utero. And we all know that there is no passage of immunoglobulin molecules from the dam to the calf across the placenta while the calf is in utero. So the calf relies on ingestion of colostrum in order to absorb immunoglobulin molecules across its neonatal enterocytes after birth. And when that doesn't happen, the calf is said to have suffered from failure to transfer passive immunity. And the reason that that's so important is that calves that have low serum IgG concentrations are more likely to get sick, more likely to die, less likely to conceive well, and less likely to produce well in their first lactation. So huge effects on productivity and sustainability for your dairy farms. So you all are also very familiar with the 5 Qs of colostrum management. So calves need to ingest enough colostrum quickly enough. So ideally, 4 to 6 liters of colostrum in the first 2 to 6 hours of life. And it needs to be of high enough quality, so over 50 grams per liter of IgG. The environment needs to be very quiet, so no stress. And also you need to quantify what's going on in your farm. So measure calf serum and measure colostrum quality. And the other aspect of colostrum quality, which we've done a lot of recent work on, is bacteriology, so how clean it is. So it's not really just about IgG concentration, but it's also about keeping the bacter loads as low as possible. So what do we know about extended colostrum feeding? So even though the neonatal enterocytes become impermeable to large IgG molecules by the time the calf is about 24 hours old, the antibodies continue to be of benefit to provide local gut immunity against specific intestinal pathogens like rotavirus, E. coli, and crypto. And colostrum is also very fatty, as anybody who has seen it will know. So it's an excellent energy source, and it provides lots of beneficial nutrients, vitamins, and minerals. And I'll show you some of those in the next slide. But essentially, this has huge benefits for the calf in terms of growth and health. So we focused a lot on IgG in the literature up until recently, but colostrum is really the perfect cocktail of nutrients, immune modulating factors, and other goodies that the calf really needs. So on the right side of this slide, I've tried to summarize some of the non-specific antimicrobial peptides in colostrum, including lysozyme, lactoferrin, lactoperoxidase, which all have specific benefits for suppressing bacterial growth. And then there's a whole other cocktail of other goodies like immune modulators, cytokines and hormones, immune cells like neutrophils, macrophages, and leukocytes, vitamins and minerals, and then insulin and insulin-like growth factor, which is absorbed through the intestine and acts through the somatotropic axis to improve growth and organ development. And then in the pink box, these wonderful goodies called oligosaccharides, which have been shown in the recent colostrum literature to act as a substrate for beneficial bacteria such as bifidobacteria species in the gut, and to prevent adherence of pathogenic species to the intestinal lining. So extended colostrum feeding, as Kat's already alluded to, is actually an umbrella term, and you can feed either first milking colostrum, so the first secretion after the cow calves, and you can feed that in small quantities for an extended period. The literature doesn't really agree yet on how long to feed it for, but much of the literature is focused on feeding for anything between 5 and 14 days, sometimes up to 21 days after the calf is born. So, you'll see in some of the graphs that I show later in this presentation that we're looking to provide about 10 grams of IgG per day for a minimum probably of 5 days after the calf's born. So you can do that through providing first milking colostrum, either in frozen ice cubes. So if you're meeting that 50 grams per liter in your quality metrics, then you need about 4 50 ml ice cubes to provide 10 grams of IgG, and you can add that either to the milk replacer or to the whole milk that you're feeding to calves, or you can use a colostrum replacer product. It must be a colostrum replacer and not a colostrum supplement. So you get what you pay for, unfortunately, with those man-made products. And it needs to provide a good amount of IgG, so at least 100 grams of IgG per dose. And you can add colostrum replacer to the milk replacer feed in order to supplement them. And then the thing that we've worked on most recently is using transition milk. So what we did was we tested the transition milk from milkings 2 and 3 from a number of Scottish cows with a Brix refractometer. And any of you that have used that in practice will know that 50 grams per litre equates to around 22% on the Brix. And the transition milk that we collected was measuring around 14% on the Brix, which still means that there's some 30 grams per litre of IgG in that transition milk. And the transition milk is really rich in all sorts of other bioactive compounds like the ones I've described in first milk and colostrum as it transitions to whole milk. So these are just some ideas for supplementing extended colostrum feeding. And we've done some work looking at how chemical preservatives can help farmers to preserve colostrum. So we did this work in New Zealand because we had a flood of colostrum in seasonal calving systems, and we looked at the change in IgG concentration as approximated by Brix using a chemical preservative called potassium sorbate, and then a yogurt additive and nothing at all, both at ambient and refrigeration temperatures. And I just wanted to draw your attention particularly to the bacteria counts. So what we found was the potassium sorbate. And if anybody's interested, I can provide a recipe for using that. I know a lot of UK vets have really embraced it lately in order to preserve the transition milk or the first milk in colostrum without refrigeration. So you sort of spike the colostrum or the transition milk, and you can leave it at ambient temperatures, probably up to 3 or 4 days before you feed it. We've just done some hot off the press work in our lab looking at how much potassium sorbate we really need. And as you can see here, a 1% concentration of 50 grams in 100 mils of water. So that sort of solution, that sort of higher solution at 1% by volume seemed to work really well, both at ambient temperatures and refrigeration temperatures. So if anyone's interested in that, it's a useful on-farm tool to try and facilitate extended colostrum feeding. And our farmers have really embraced it. So the only thing I would say is potassium sorbate is not a silver bullet. So you really do need to make sure that your colostrum and transition milk is very clean before you try and preserve it, because it's not going to kill any bacteria that are already there. And you won't see the benefits if your colostrum and transition milk is very dirty. So I just wanted to show you some of the latest literature that's circulating. This was a 2020 study looking at weight gains from calves fed very short period of time transition milk feeding 2 to 3 milkings 2 to 3, and you can see that compared to milk replacer alone, the transition milk and the colostrum, so this was first so colostrum replacer, so that first it's equivalent to first milking, had the same effect on average daily gains. So that's encouraging, because transition milk should by all rights be abundantly available on farms and could be put to really good use to try and improve average daily gains in calves. This is another study where they fed transition milk for 21 days. And you can see that, well, this graph's a bit muddled, but basically they added either half a litre, 1 litre or 2 litres. And in the 2 litre transition milk group supplemented, they saw an overall body weight improvement post-weaning. Small but significant differences. And any gain in my book is a good gain. This was done by Anna Katerina Burge in Belgium back in 2009. And as I've already said, it was 10 grams of IgG that she's advocating, which is equivalent to about 70 grams of colostrum supplement. And this is a survival curve. So essentially everybody starts off 100% of them healthy in the top left corner. And then the steeper the ski slope, the worse. So you can see in the colostrum supplement group, they actually performed much better in terms of number of days to first treated diarrhea event compared to the unsupplemented control and the placebo supplement groups. Many of you will have seen the PIRE work looking at villi development in the intestine, and the two groups that are of most interest here were transition milk and colostrum mixed with whole milk to make like a transition milk mix, and then colostrum supplement. And there's not really loads of difference in my mind anyway between the villi development in those two groups. Potentially slightly better in the colostrum group, but it's more difficult in practice, I think, to supplement with colostrum, and also more expensive if you're using a replacer. And this was the C panel here, is the just milk replacer only group. So that has implications for growth and development. And then this is the Wisconsin-Madison health scoring chart that some of you will be familiar with, and it's an objective way to score calves. And literature from 2017 and 2014 used this scoring chart to show that there was a difference in morbidity and mortality in calves that were either fed colostrum replacer or transition milk. So they did fare better than their counterparts that were unsupplemented. So the question we always get from vets is, how are we going to get farmers to feed colostrum in an extended way? And we surveyed about 250 farmers from all of the countries in the UK. And we were surprised to find that quite a few of them were already feeding colostrum for 3 to 5 days, so 27.5%. And interestingly as well, when we asked them whether they would be prepared to make changes to their management or systems, if we could show that there was a benefit to doing so, then 3/4 of them said that they could do that. So that was encouraging. And we published this in Livestock last year, the year before, but basically we did some thematic analysis asking the farmers what the challenges were, and they came out as sort of 3 general categories, so physical, human, and animal. And you can see here under the animal category, Pete's going to talk about Johne's risk when you're feeding transition milk from multiple cows. If you can't feed dam only transition milk, which would obviously be the ideal scenario. And then things like, labor, putting good protocols in place, bigger fridges, but then potassium sorbate might come into play, and other equipment and sort of more physical issues with trying to get an extended colostrum feeding protocol off the ground. And then lastly, I just wanted to point out the difference between colostrum, which is of course wonderful and is really my jam in terms of research interest, but there is a difference between colostrum and hyperimmune colostrum. So this is just a quick summary of the literature. Obviously you will see health and growth benefits, as I've already said, with using any kind of colostrum or transition milk supplement, providing you harvest and feed it cleanly. But in the literature, non-hyperimmune colostrum, so colostrum that had specific antibodies boosted through dam vaccination, did seem to have a positive effect on calf demeanor, but no effect on mitigation of diarrhea, whereas hyperimmune colostrum did reduce clinical disease, as you would expect, really. And the more passive transfer of anti-C parvum through colostrum during the first day of life, the less cryptosporidium, as you would expect. So, and the vaccine's been shown to reduce oocyst shedding and a highly statistically significant improvement in health, reduced incidence and duration of severe diarrhea, and increased weight gains. And then MSD have also funded some seed trials in the Netherlands and France, and they did see benefits of using the vaccine in practice. I think we're going to take questions at the end, so I'll pass on to Pete.
Hi there. I'm going to talk about how we navigate Johne's disease and cryptosporidiosis vaccine. Back in 2009, 2/3 of farmers were pooling colostrum and feeding waste milk to calves. Recent data we've gained through My Healthy Herd show it's now down about 10% in our last survey we've looked at. If we actually look at what we're trying to achieve, I want to sort of take you through what are the risks of transferring Johne's disease via milk and colostrum, and then how are we going to mitigate those risks? Because I think it's important for us to not solve one disease and then cause another further down the line. I'm going to talk a little about herd examples and how to manage vaccination in different herd settings. And then finally about getting it right and making sure you've demonstrated due diligence, which I think is an important thing too. If you look at the literature, milk risks versus fecal risks, Johne's disease or paratuberculosis, basically it's a fecal oral disease. So the predominant challenge comes from feces. So if we look at the clinical stage of paratuberculosis, the number of MAP cells shed into milk is relatively low, about 100 CFUs per mil. In colostrum, it's slightly higher. Infected cows without clinical signs, so these are the ones that would test positive but have no clinical signs, have substantially less CFU of MAP, down between 2 and 8 CFUs. So if we can make sure that we can segregate cows in some shape or form, then we can actually mitigate that risk. Now, to try and put it in perspective, though, the levels of MAP in feces can exceed 10 to the 8 in clinically ill animals. So, you know, that's why I think we find when we're controlling Johne's disease, if we just focus on trying to buy a pasteurizer, for instance, or minimize milk risks, that's just not enough to control the disease. So cow-to-calf infection via feces is the primary one-to-many risk. So hygiene is important. It's really important if we want to control the disease, but also it's important if we're trying to sort of manage herds where we plan to use crypto vaccination. And the photo on the left actually shows quite a clear issue. If we have a pen of low hygiene, then we have a risk when we harvest the colostrum that we actually have a more contaminated colostrum. You know, for lots of reasons, that's not a good idea. Soren Nielsen did some work looking at risk factors, and this first work was done in 2008, and he found that animals fed colostrum from multiple cows had an odds ratio of 1.24 of being ELISA positive compared to animals fed colostrum from their own dam. If we looked deeper and looked at foster cows, they were twice as likely to test positive compared to calves fed milk replacer. So, you know, the foster cow is quite a high risk because we probably have a combination of fecal risk as well as milk risk. What they found, however, that feeding bulk tank milk and pooled milk from cows with high somatic cell counts didn't increase the risk of being ELISA positive. And their conclusions, these are word-for-word conclusions from the paper. They suggested that the source of milk and colostrum can be risk factors in the development of antibodies to MAP. However, they probably play only a minor role in the transmission within the dairy herd. So what he's trying to say is that, you know, this is one of a number of risks there, but the most important ones are the fecal oral route. In 2011, he went on and did some further work, again, survey-based work, and this basically shows these are herds that all start off with a similar level of prevalence, and then he tracked them in going forward over time. And he found basically herds with increasing prevalence were the ones that continue to purchase cows. They let the red cows, the repeat test positive animals, calve again. And despite feeding milk from green cows, they basically had a rising prevalence. The herds with the most improved reductions basically were closed herds. They did feed waste milk from green cows and no or some red cows calve again. So basically that group that had the best response were feeding milk from green cows, and they got the optimal response there. They did some univariate analysis, and this really sort of spells it out. I mean, if the herds that basically close the herd down, they got a 72% reduction in Johne's disease in those herds. If they, for instance, made sure that no red cows calved again, they got a 56% reduction. But when we actually look at waste milk from all cows, that was a 24% reduction. Green cows only 40% reduction. So you can see a situation where there's almost like a pyramid of risks that we have to consider. So to summarize the work, biosecurity is really important. Culling was a very important element as well, avoiding recalving of red cows. But the milk risk delivered benefits, but not as great as the impact of culling and biosecurity. Now that's a survey looking at an average effect across 1,000 herds. But what you have to do is to evaluate the specific farm risk, the individual farm risk, because that may be substantially different. So the risks are highly herd specific, and they're very much dependent on prevalence, and there's a large variation in hygiene, facilities, attitudes and resources on the farm. And it's your job to sort of tease those out and make a judgment as to whether you feel it's important or that this farmer uses crypto vaccine, or where basically this farmer wouldn't be able to use it because if he did use it, there may be massive problems with Johne's disease because you couldn't possibly sort of control the level of infection going into milk. So Johne's infection by colostrum in milk, there's a broad consensus. Contaminated milk and colostrum is a risk factor that requires management. We know that controlling those risks alone is not enough to control Johne's disease. So how can we advise the use of pooled colostrum without exposing ourselves to a risk that we potentially triggered a future Johne's disease outbreak? That's the sort of thing that I'm sure many of you are thinking, well, hang on, if I advise my farmers to do this, are they going to come and get me in 5 years' time if the Johne's disease pops up? Well, how to mitigate colostrum and milk risks? On an individual cow basis, the best mitigation is to test that animal, identify it clearly and obviously, and segregate it. And if we can actually make sure that no milk and colostrum is harvested from that high-risk animal and fed to our highly susceptible replacement calves, that's a really important step. We want to source colostrum and milk from low-risk green cows. We want to source, if we do get into difficulties, consider sourcing replacements at low-risk times of the year or certain parts of the breeding cycle where it may be easier to get hold of replacements which are going to be low risk for Johne's disease. And that's been covered in the BCVA training. But a really important point is that on an individual cow level, we must maximize hygiene when harvesting colostrum. The whole mentality about how we harvest colostrum is really important. Overlaying that is the herd level. We want to reduce the prevalence of Johne's disease on the farm. The risk of any milk and colostrum cross-contamination and all this sort of thing reduce markedly if we can reduce the level of infection on the farm. So we need to have an effective Johne's disease risk and management plan in place. And we have to actually achieve those behavior changes to optimize hygiene and husbandry. I think we know what we have to do now for Johne's disease, and we do have to improve the hygiene and husbandry. So feeding pooled colostrum and milk from low-risk green cows in well-managed hygienic farms with a robust, compliant Johne's disease plan, that will be an acceptable risk. I think you could explain to the farmer what you're doing and what the importance of making sure that they did everything possible to make sure that no test positive animals get into that system, and you have good hygiene right the way through the calving line and the calf line. I think that will be a reasonably acceptable risk. However, controlling Johne's disease in crypto is much less effective with lower hygiene. So in these sorts of environment, the risk of cross-contamination is much greater, particularly if you're harvesting transition milk, for instance, and there's a number of heavy shedders or high shedders within the milking herd. That would be a more challenging situation. So you would have to work reasonably hard with those farmers to make sure that you mitigate a number of these risks to make sure that we could safely do that. We know also that controlling Johne's disease is much less effective with lower hygiene. We get one-to-many spread. If there's a heavy shedder present, we get cow-to-calf transmission, it's much more likely, and also calf-to-calf transmission. So this is the graphic. You've seen this plenty of times before, those of you who are Action Johne's advisors, but you have to do a risk assessment so you understand what's going on the farm. You've got to know the status, because once you know the status, you can make informed decisions about Johne's disease, but also in this case, the use of crypto vaccination, and you need to develop a written plan. And the final 2 or 3 slides really is a bit of a due diligence checklist. It's important for you to do a detailed risk assessment to identify remaining Johne's disease risks. If you do that well, then to some extent, there's no way the farmer can come back at you in 5 years' time saying, well, hang on, my disease has gone out of control. You want to optimize hygiene in the maternity and calf areas, because you'll get a double win for both Johne's disease, but also for other enteric pathogens that affect calves, such as crypto. Consider sourcing replacements at low risk times of year or low risk times of the breeding cycle. But you have to be 100% certain that you've got good identification of high risk cows. And what I mean by that is all previous test positives. So any animal that tests positive is identified as a high risk animal and is clearly marked with tags and tail tapes and any technology you have on the farm. And then harvest colostrum carefully, disinfect teats, clean receptacles, minimize cross-contamination. If you don't have confidence that the plans were applied effectively, do something different. There's always something different you can do. So you can change the strategy, for instance. You could change the strategy to breed to terminal sire and source replacements from low-risk herds. Or you could upgrade your existing plan. But you have to do something different for this to be a safe and sensible thing to do. You need to know the Johne's disease status of herds and cows. You know, you can't go into it blind. An unknown cow could develop clinical disease tomorrow, and that would be a disaster, basically, if that went through the maternity unit. You can delay serving of high-risk cows in block calving herds and source replacements at low-risk times of the year. And I think this sort of area of nudging the breeding around is quite a useful way of actually achieving the results, particularly if you start using sex semen that you want with Johne's disease. So just to summarise, pulling colostrum and milk from test negative dams is an acceptable risk if done properly in the right herds. So you have to use your clinical judgment as to whether you feel that's appropriate or not. You must assess and make professional judgments on whether the Johne's disease and crypto plan will be applied successfully. Both are very demanding. And ensure you conduct a robust Johne's disease risk assessment and evidence your advice and caveats in writing. So thank you.
Thanks for that, Pete. So that concludes all of our presentations today. If you, just a reminder, if you have got any questions, please pop them into the chat function at the bottom of your screen. We have had a few come in, so we'll hop straight to those questions.
So if you have any questions at all, please put them in the chat, and we're obviously happy to take them.
Yeah, no, that's great. And I'm not sure, Kat is having some internet issues, so
yeah, it keeps kicking her off. But it's fine. Yeah. We'll just bash on, and hopefully she'll reappear at some point.
Yeah, so we'll crack
I'm trying my best.
Great. We'll crack on with the questions that we've had come in. So, so Katie, someone, I think this was related to. This is a message from Jeremy. It was related, I think, to your presentation. How large is the ice cube of colostrum?
So I like to use 50 ml colostrum ice cubes, which you can buy like silicone trays of on Amazon fairly easily. Because if you use a 50 ml ice cube of first milking colostrum, and you're reaching your quality target of 50 grams per litre, that's going to provide roughly 2.5 grams of IgG. And so you only need 4 of those if you're going to feed colostrum in an extended way. So that's what I would recommend.
Brilliant, that's great. And then next one, what safeguards or protocols would you recommend ensuring both Johne's control and cryptosporidiosis prevention are addressed? So I guess that's one for you, Pete. I guess that's what you've been discussing. Really, I don't know whether you want, if there's anything now you want to pick up on.
Maybe he's frozen.
Can you hear us, Pete? Nope. We'll move on. We'll move on to the next one. We can come back to that. So this is maybe one for you, Katie. What practical tips do you have for ensuring consistency in colostrum management across different calf rearers on the farm?
Yeah, I'm a massive fan of really simple laminated protocols that are really, you know, as easy to follow as possible. So if I'm doing this type of consultancy work with calf rearers, and there are multiple calf rearers, particularly at the weekends or in the evenings, and inconsistencies in hygiene and other quality metrics are problematic, I would get your laminator out, make something that's really pictorial, make a nice flow chart, but get buy-in from all the calf rearers. So if you can get them all around a coffee table, ideally, bring them coffee, that sometimes works too, and get them to help you, because if you make it and stick it to the wall, no one will read it. So you need buy-in at the kind of making the protocol phase, and then you need to monitor it. So what I was saying about measuring calf serum IgG concentrations and measuring colostrum quality with a Brix refractometer, then you can really see whether the protocols are working and whether everyone's following them. Yeah, so hopefully that's helpful.
Yeah, no, that's great, thank you. And another one actually that would be for yourself, Katie, is, I know you talked a bit about this might also be one for you, Kat, but how long should farmers continue colostrum feeding to maximize immunity against cryptosporidiosis?
Yeah, I can. Oh, I'll take it while I'm here, because I keep getting cut off, and then Katie can always jump in after. But yes, so really they hopefully sort of outlined this at the start, but they do need to be feeding either colostrum or transition milk for at least 5 days. So it doesn't need to be the entire feed, but at least a proportion of the feed needs to be colostrum or transition milk. But yeah, feel free to jump in, Katie.
Yeah, I think the vaccine efficacy relies on at least 5 days of feeding. But a lot of the peer-reviewed published literature is actually advocating for anything up to 14 days if you can manage it. So you will see other benefits beyond cryptosporidiosis prevention. So yeah, there isn't, unfortunately, consensus in the literature on how long to feed to get those growth and health benefits. But certainly for the vaccine label claims, it must be at least 5 days if you can manage it.
Yeah,
actually, I was going to point out that we have a farm up in Scotland that are giving whole milk all the way up to weaning, and they're using the vaccine, and they've had really fantastic results, actually. So they've said they've had no sick calves and no deaths since they've been using the vaccine, and then they're feeding whole milk up to weaning. So I think the longer you can feed it, the better it is.
Brilliant. I mean, what would you say, this is another question that's coming, what would you say to a farmer who is hesitant about vaccination, fearing it will complicate calf rearing routines?
it can complicate calf rearing routines. It depends on what they're already doing. In the survey that Katie mentioned, a lot of the farmers were already doing some form of transition milk feeding. Generally, it was around 3 days. So if they're doing 3 days, they can generally push it for another couple of days without too much difficulty. And a lot of these farms will be also having to either give like a halofuginone or something else in the milk, which is again quite complicated for calf rearing. So you would hope if they were vaccinating that they could stop doing that, and then it would make it a bit more simple. So yeah, there will need to be some support and hand holding at the start when they first kind of feed transition milk for 5 days or so. But once they've got into that routine, it's generally tolerated very, very well. And I don't know if Katie's got anything to add to that.
Yeah, I think you have to offer all the options, I guess, in terms of what the options are for getting this extended IgG exposure for the calves for the first 5 days of life, and then talk to them about whether they want to use cold temperature preservation or chemical preservation, or whether they want to do transition milk or colostrum, first milking colostrum in ice cubes. Really just present all the options and get them to problem solve for their own unique system, rather than trying to force a square peg into a round hole.
That's great, thanks. I'm just going to come back to Pete. Can you hear us, Pete?
Still
I
struggling.
thought he was back.
Yeah. Can you hear us, Pete? No, it looks like his signal's quite weak. So I think that probably concludes all of the questions, unless any of the speakers have anything else that they'd like to add.
There was one, wasn't there, about antibiotic use? Did you cover that while I was trying to get back on?
No, I don't think so.
I mean,
just like that, Kat. Sorry. I just wanted to say, in line with some of what Pete was saying about Yoni's disease risk through colostrum and milk feeding, the other one that comes up quite a lot is mycoplasma. And we look for mycoplasma in colostrum. The Belgians looked for it, and we looked for it. And we found very low prevalence of mycoplasma in Scottish colostrum, and in Belgium they found the same. But I really just wanted to, I probably didn't cover it as much as I should have. The hygiene of colostrum is so important to prevent pathogenic species transmission of all kinds, but also coliform bacterial species will prevent IgG absorption from the gut. So when we've surveyed, so I've measured colostrum bacteriology in New Zealand and Scotland, and it's filthy. So there's a lot of low-hanging fruits, and it will make a huge difference to your calf rearing operations.
Yeah. We did mention actually in the farmer webinar earlier this morning, pasteurization, which hasn't really been touched on here, but it is something that I think a lot of farmers are looking into, and can really help with disease such as mycoplasma and Yoni's, so it did seem something that farmers are very interested in. I don't know if Pete can hear us, if you want to comment on pasteurization with Yoni's.
Yeah, sure. Can you hear me?
Yes, we can.
Yeah.
Good.
Oh, that's good then. Okay, that's fine. Yeah, I can hear you. I can't hear you, Sarah. I mean, pasteurization, it was very popular back in the noughties, and a lot of people thought it was going to be a holy sort of grail for Yoni's control. But clearly, because of the fact that it isn't the major transmission risk, it hasn't basically expanded further. But I think it is a sensible thing to do. But again, it's making sure that nobody contaminates the colostrum after you've pasteurized it. So it's a fairly self-selecting thing. If somebody's good enough to have a pasteurizer and to follow those protocols, they're probably good enough to actually get good controls in other routes as well. And so the problem we always have is the farm where they're not very good at protocols. That's where we're going to have the challenge. The farmer has crypto where they're not very good at protocols, and that's always going to be the difficulty, isn't it? And that's where I think we have to be careful in terms of how we use the product, so that we don't obviously get a
That survey work that we did, Kat, there was only about 10% of the UK farmers were actually using pasteurizers from that survey work. And my experience of them is that people love them like a silver bullet, but they're very prone to human error. You can cause denaturization of IgG molecules if you heat the colostrum to even like 62 degrees rather than the prerequisite 60 degrees. And I would just advocate for like fairy liquid and a scrubbing brush before they start like.
That's your favourite thing.
Yeah, no, exactly. I couldn't agree more. Is that I think it's, you don't leap to pasteurizers before you've got the other real common basic hygienic things done properly first.
Yeah, totally.
So I think that's what we keep it really simple. I think and try and get the basic stuff done really well.
Yeah, I mean, I think, Pete, because you couldn't hear Sarah speaking, she did ask you a question, and you've sort of addressed it. It said, are there any safeguards or protocols you would recommend ensuring both Johne's control and cryptosporidiosis prevention are addressed? I mean, that is a big question, and you've kind of gone into it in your talk as well. Yeah, I mean, if you've got any final comments around that, but you have gone into it.
If you want to tackle both those diseases, then clearly hygiene is key, isn't it? So, if we can reduce the challenge through whatever mechanism, fecal challenge for crypto, fecal challenge for Johne's, any challenge through the milk, if we can actually mitigate that, that's a really, really important thing to do. And then the other thing is resilience. How best can we actually optimize the resilience of the calf? And the same thing goes with the dam. So we know if we have resilient cows, we get a totally different sort of picture for Johne's disease. The same situation, I'm sure, would apply with neonatal calves too. So I think there's some recommendation there, but we do need to have this sort of segregation of high risk and low risk animals. I think that's important, and the same would apply with crypto. If you've got infected calves, they're highly likely to contaminate the environment. So if we can segregate infected animals from healthy animals and use plenty of disinfectants and probably less antibiotics, then things will be good.
Yeah, exactly. I think we're coming towards the end. I just was going to mention that we have another webinar for farmers next Friday. And so vets and farmers can sign up for this, but it is a farmer-based webinar to discuss crypto and managing crypto. But I'll pass back to Sarah because I'm sure she's going to mention it as well.
Yeah, no, that's great. Thanks very much, Kat. So thank you so much to all our speakers today for joining us and giving us such a good insight into cryptosporidiosis and how we can manage that on farm. And hopefully that's been of use to yourselves and something that you can help pass on to your clients to help provide some tools and fresh perspectives to take back out into practice. A recording of the webinar will be made available afterwards, and that will be emailed to you. And along with a link, as Kat mentioned, to the webinar that's taking place next Friday at 11 o'clock, that is on talking firsthand about cryptosporidiosis. So we have a couple of vets speaking during that, and also a farmer who was one of the first farms to adopt vaccination and has seen really good results in reducing cryptosporidiosis on their farm. So yeah, he's going to be giving his first-hand experience. So if you can share that within your practice and within your clients, farmers that are maybe affected, and make them aware of that is taking place next Friday at 11 o'clock. But yeah, on behalf of all the speakers today, thank you very much for joining us, and I hope you have a good rest of the day. Thank you.
Thank you.
Thanks.